So thanks everyone for joining us for today's Strengthening Families monthly webinar. I'm very excited that today we're hearing from Tabitha Kelly in Arlington County about their promising practices and how they're infusing protective and promotive factors into their work. So very glad that a lot of people were interested and signed up, and excited to hear about all their innovations there. So I'll just run through our agenda quickly. I'm Kaylin O'Connor from the Center for the Study of Social Policy. I'll be sharing some updates from CSSP. We'll have some updates from our partners at the National Alliance of Children's Trust and Prevention Funds, represented today by Trish Hallmark. And then we'll get into our topic about the work that's going on in Arlington County. So without further ado, we'll go ahead and get started. Let me make sure that my screen is not paused. It's fine. Okay. There we go. Now you can really see my screen. I had paused it earlier, so just had to check on that. So I'm Kaylin O'Connor. There I am. A couple tips from GoToWebinar. As you are listening, if you're having any trouble hearing, it might be that you need to change which audio mode you're in. If you have called in by the phone, you need to enter your personalized audio PIN that will show up on your screen. That's how the system connects your phone call to your registration for the webinar, and that's how we're able to unmute you if you do want to speak. So please use that audio PIN, particularly if you want to be unmuted at some point. If you have a question or a comment during the presentation today, please either feel free to type it in the chat box or the question box, or you can raise your hand, and that will allow us to see that you want to speak, and we can check in with you and unmute you. If you're having trouble through the phone, try just listening through your computer, and vice versa. That's usually the easiest fix, but if you're having other problems, type it in and let us know. We'll try to help you resolve it. So a little bit about these webinars. We put out an open invitation to this each month to anyone who's using the Protective Factors Framework and coordinating Strengthening Families efforts in their program, their community, their agency, their state. We convene these jointly between my organization, CSSP, and the National Alliance of Children's Trust and Prevention Funds, as I mentioned. And we work together to coordinate the topics and find guest speakers. And we are always excited to welcome volunteers from the Strengthening Families National Network to either share some interesting work that you're doing or to suggest a speaker that you think would be really relevant for this group. So please let me know if you have suggestions for that. And we always record the webinars, and we post the recordings and the materials. The Alliance maintains a lovely archive of all of those webinars going back a few years. So you can always, if you miss it, go check that out, or just scroll through and see what topics we've covered in the past that you may have missed. Can make for good listening, and it's always a source of good ideas for how you might use Strengthening Families in your own work. So our upcoming webinars, November 10th, we're going to hear from folks in Calgary about, in Alberta, about how they're using Strengthening Families to inform a collective impact approach. And they've been doing some really interesting work there in their first 2,000 Days initiative. And I'm very excited that they're going to join us next month to talk about how they're doing that. And I particularly encourage you, if you know others who are using Strengthening Families and Collective Impact, have them connect into that call. We'd love to get some conversation going about other people who have done that or tried it or are interested in it, and we look forward to hearing from that, from that group. And then in December and January, the dates are there. You can mark them on your calendar now. We always do this on the second Thursday of the month, and we are always excited to get your suggestions for topics, as I mentioned earlier, so feel free to let me know. Okay. I only actually have one other update to share from CSSP this month. I wanted to make sure that you knew we've gotten a couple of exciting new pieces out of our Young Children and Families team, which includes the Strengthening Families work, but other pieces of our work as well. So we just put out a policy report called Supporting Young Children, Addressing Poverty, Promoting Opportunity, and Advancing Equity in Policy. And along with that, there's a fact sheet about poverty in early childhood, the data about it and why it matters, and some suggestions of what we could do about it. So please check those out. I actually didn't put the website there. It's just on cssp.org. These are both on the front page right now, but you can also go to our website, you'll see we now have a tab on our front page for our Young Children and Their Families team. And so you can find both Strengthening Families and Early Childhood Link and other related resources like these ones under that tab. So we're excited for that small organizational development, but it makes it a lot easier for others to see how all our work fits together. And then we have some updates from the National Alliance of Children's Trust and Prevention Funds, and Trish Hallmark is on the line to share some exciting events that are coming up.
Thank you, Kaylin. Hello, everyone. My name is Trish Hallmark. You may know me. I provide administrative support to the Alliance, and so I'm probably a sore replacement for Teresa Rafael, Martha Reeder, or Mara Levine. But we want to share with you about our second annual virtual convening that's hosted by the Alliance and the Birth Parent National Network. It's coming up in November. Occurs on Thursday, November 3rd, and Wednesday, November 5th. Both of them are at 11 a.m. until 1 p.m. Pacific time. And it's an opportunity for you to sit in and hear some keynote presentations, some parent voices about the ways that parents are transforming systems. As with any meeting, we have goals and we want to share ideas and resources with the listeners, with parents, with organizations that support parents. It gives you an opportunity to develop some knowledge base and hear how strategies are discussed. And like I mentioned, you'll hear from keynote speakers, and one of them, in fact, you're probably quite familiar with is Pat Stanislavski. And that's a real fine colleague of the Alliance. She's actually the director of the Partnering for Prevention, but she's also a senior consultant here at the National Alliance of Children's Trust and Prevention Funds. And she'll be doing a presentation on building resilience in your family and other families in your community. And if you know Pat, you'll know that it'll be a really strong and vibrant presentation. We also have parents of the network doing some really fine presentations on building protective factors, on implementing parent-partner programs, and it's just an opportunity for you to learn and hear from people within the country and within the BPNN that are moving parents' voices forward. And then a little bit about the November 9th presentation. Let's see, I lost my site. Oh, here we go. A really good presentation from Jennifer Rodriguez, who is the Executive Director of the Youth Law Center and Quality Parenting Initiative. She's going to talk about this initiative that brings foster and birth parents partnering together to help make changes in public policy. And then, like I mentioned before, we'll have other parents presenting about some of the BPNN strategies that they've been focusing on over the last year and an update on those. And lastly, we'll end with a nice presentation on the research that's being conducted by Jerry Damon out of the University of Kansas, focusing on the different perspectives of parent partners at the various multiple sites in the U.S. That may be more than you'd ever want to know, and I don't expect you to memorize it. So there's a handout attached to this webinar that you can download, and then you can register at bpnn.ctfalliance.org and join us on November 3rd or 9th. You only have to register once to attend both. Thank you.
Thank you so much, Trish. I would argue that you were an excellent stand-in for your colleagues who couldn't join us today, so thank you for representing the Alliance and sharing that information. Those are going to be some really exciting convenings. All right, we are going to jump into our topic of the day, which is about Arlington County's Promising Practices, a Protective Promotive Factors Journey. And I'm very pleased to introduce Tabitha Kelly. She's a licensed clinical social worker and certified public manager. She's the Director of Social Services in Arlington, Virginia. And as you will soon hear, she has a great passion and excitement, I might even say exuberance, for finding new ways to better serve the children and families of Arlington County and for supporting her staff in how they can best do that. And I think, as you will hear soon, she's found some really innovative ways and has worked with her staff to implement strengthening families in some really exciting ways. So I'm glad for you to get to hear from her. Tabitha, the floor is yours.
Thank you, Kaylin, and I want to thank you and the CSSP for the opportunity to share what we're doing in Arlington County to take a protective and promotive factors approach to our work with children and families. I'm really honored to be part of this conversation. And before I begin, I'd like to acknowledge that you may hear my voice today, but this would not be possible without my very capable, creative, and committed team who's helped me to transform these ideas into action. So in today's session, I'm going to share how we're taking the protective and promotive factors and creating some small but significant changes in our daily practice. In the words of my most beloved child advocate, Maren Wright Edelman, I'll share a quote that I love that she said, "We must not, in trying to think about how we can make a big difference, ignore the small differences that we can make, which over time add up to big differences that we could not possibly foresee." And I really like this phrase because it really kind of embodies the work that we've been doing in Arlington County over the years. So let me begin by providing you a little bit of context about who we are in Arlington County. Arlington, if you see it on the next slide, yes, Arlington, Virginia. It's a diverse urban county of about 26 square miles located directly across from the Potomac River from Washington, D.C. We have a population of about 215,000 and growing. We're one of the most diverse communities in the D.C. metropolitan region. In fact, in our school system, in Arlington Public Schools, they've indicated that there are 99 different languages spoken in Arlington Public Schools, and the children come from about 129 different countries. So that's a lot of implication for the social services provisions that we have here in Arlington County. I'm going to move on to share a few things about the Department of Human Services. You'll see that our mission statement truly reflects the protective and promotive factors. Our mission is to strengthen, protect, and empower those in need with the ultimate vision, the big, hairy, audacious goal of having a community of healthy, safe, and economically secure children, adults, and families. Within the Department of Human Services, there are 5 divisions. We serve about 60,000 unduplicated clients a year. Within our complex, clients can enroll in public benefits, they can get immunizations and dental care, sign up for WIC, get mental health services, and ensure their loved one is getting good long-term care as they age. Child and Family Services Division is just one of the divisions in the Department of Human Services. And moving forward, you'll see that Child and Family Services is made up of Children's Behavioral Health, the Child Welfare Bureau, Child Care Licensing Services, and the Community Partnership in Education. Our system, our child welfare system in Virginia is a state supervised but locally operated system. And Arlington obviously is just one of them. And if you look at our outcomes, you'll see that we're not a huge child welfare system, nor are we a huge department. There are 89 full-time employees here, but our work is quite remarkable. You'll see there are 3,000 calls a year to the child abuse hotline. There's validated reports for Child Protective Services at around 10% of those. We remove 50 children a year, unfortunately, who are in unsafe situations, but we also reunify and have great rates of adoptions. We have a 928 calls for information screening and for behavioral health care services. And we have a forensic interviewing team that in the Child Advocacy Center here. So Arlington's services over the years we've steadily improved through evidence-based practices and strength-based initiatives. We prided ourselves in doing some really good work. However, admittedly, we lacked an overarching philosophy and a shared language that led us to describe the work that we're doing in a universal way that we could all relate to and understand. And this is what has drawn me to the Protective Factors Framework, because it helps us to describe the work that we're doing in a universal language. It fosters greater collaboration. And we've actually really grown to appreciate the role that we all play in an effort to build the capacity of the families that we serve. So I call Child and Family Services Division the little engine that could. And moving forward, you'll see that in our system, we want the same things that everyone else wants, right? We want coordinated and effective response to children and families that promote safety, permanency, and well-being. We want to reduce the imminent harm to children, repeated maltreatment and foster care reentry, and reduce the length of stay in out-of-home care. Personally, I have dreams that child abuse would no longer exist and I could work myself out of a job. I can't think of anything else I would rather do, but I would gladly give up my employment and find something else to do if it meant the end of child suffering and pain. But until that happens, we're going to keep on pressing on. So what are the strategies that Arlington employs to reach our goals? You'll see here on this wheel that the wheel represents how I began to look at the ecology of the Child and Family Services Division and the spaces where I thought the team and I could make the most impact. I wanted to look holistically and anticipate the changes that needed to be made so that we can infuse the protective and the promotive factors throughout our work here in Child and Family Services. And I can tell you, although this wheel might appear simple, the work is not. In my mind, the starting place is how we engage families. We approach families with the belief that they all possess the strengths and the abilities despite the current circumstances that brought us to our doors. We don't ignore the challenges or the limitations that they face, but we really want to harness the strengths that buffer the risk and increase the ability for families to make safe choices. So moving forward, we also wanted to focus on clinical, oh wait, go back for me, Kaylin. I'm going to talk about every part of the wheel. So we focused on the clinical documentation, so that includes, the case notes and the plans and all of the court documentation that informs partners about our progress. We also wanted to infuse the protective factors into the assessment and planning processes. We've changed the format of one of our parenting classes so that we could be intentional about teaching parents about the protective factors so that we could all speak the same language as well. We found in some of the researches the protective factors framework is really geared toward the service providers by far and large, but not necessarily the parents themselves. So we wanted to really get on the ground and talk to parents. It's important to note that you don't have to request massive amounts of new funding to embed the protective factors and the promotive factors approach. This approach really overlays nicely with what you already are doing in your systems. You just may need to make some tweaks and some shifts in how you allocate your resources. So we spent quite a bit of time thinking about how we could change that and how could we build a stronger safety net for families by looking at our entire child serving system. And that meant that we needed to engage our partners in new ways and in different ways to enhance our policies and to even identify those areas of overlap so that we could be more effective. And also, in this day and age, it's important to track your data, your outcomes, so that you can possibly even garner more resources. And last but not least, we strive for a continuous learning environment for our staff through training, professional development, and clinical supervision. And I'm going to go into each part of the wheel as we move forward in the presentation. Okay. As I said earlier, you don't have to reinvent the wheel, no pun intended. use what you already have that is existing within your system, but be intentional in how you overlay this approach with your current programs and practices and policies. In Arlington, as many of your own organizations, you already conduct case reviews. You already have checklists and training funds, etc. The hope is, well, my hope is, by the end of this presentation, you will see or hear something that inspires you enough to think about new ways to embed this framework into your own systems. I will be pretty concrete so that you can see that these things are doable, with the caveat that you're going to have some serious attention and focus and a lot of sweat equity for you and your team to be successful. So I'm going to go forward in the presentation and show you even more of the elements of the wheel. So I'm going to start with where it all begins, the family engagement piece. And we believe you have to put in extra effort to make children and families feel welcome. So I'm sharing the slide with you. These banners are in our reception area, and we really try to put forth not just the words that you see on this banner of hope and connections and resilience. The staff really try to embody these principles every day, because we recognize that families come to us at some of their most vulnerable points in their life. They're afraid and they're defensive, and they can feel threatened by us as government officials. So your first interaction makes a difference and can impact the course of the work. So we want to write family-friendly space as just one small way that we hope to show respect for families and invite them to engage in the processes of planning with us more fully. So our family partnership meeting is what we have called our family engagement meetings in Virginia, and it's just one of the critical central pieces of the work where we invite families to make key decisions about safety, permanency, and well-being. Each FPM, Family Partnership Meeting, is an opportunity to build the protective factors, because we intentionally bring the protective factors into the teaming conversation. We have a coordinator and a facilitator who ask specific questions that link the protective factors to the risk and helps the family to identify how that child came to our attention and how to problem solve around the safety and risk factors so that we can reduce them. And of course, we want older youth to participate in the decision and the planning making processes. And since we really began our family partnership meeting processes and embedded them firmly into our system, the results have consistently shown that we've either been able to divert children from coming into care, children experience shorter length of stay in foster care if they have in fact been removed. And this is in a really stark contrast to the days when Arlington's children languished in foster care at twice the national average. It was really, really startling. So we've done some amazing work there. Like most localities, we offer support to our foster parents so that they can build a sense of community, learn about each other, and feel comfortable becoming respite providers for each other. So we're looking at the resilience and the connections that need to be built amongst our foster parent community. And I can tell you, we have an amazing foster parent retention rate. In fact, we just celebrated one of our foster families has been providing, service to children for over 30 years. I mean, it's spectacular, and she's not by herself. It's quite remarkable. I want to spend a little bit of time talking about kinship care in Virginia, highlighting some of the challenges and also the commitment that we've had in Arlington. I don't know if many of you are aware, but Virginia, according to the Child Welfare League, and it's been confirmed by all of our, our state representatives, that we fall last. We rank last in the United States in the usage of kinship care, despite the fact that we are instructed to look for kin when children are in out-of-home placements. And there's a lot of reasons around that, but this whole idea that I've heard time and time again about the sort of corrosive ideology, the phrase apple doesn't fall far from the tree when we're talking about kinship care, and how do we debunk that? So in the words of someone I really admire, Sharon McDaniels out of Pennsylvania, she's like, take those apples and make apple juice. It's one of the healthiest, most nutritious drinks you can ever have. And if we are really honest, don't we all have that family member that we worry about and that we might not let watch our kids, or you might not even want to loan money to them? But does that family member or that subsection of that family mean that the entire family system is doomed? So we've got to change the way that we think about the families that we're serving. And you can see I feel really passionate about the subject. But really, feelings don't get the work done. So I needed to create a vision that people could buy into and mobilize into some action. So we really began to look at relative caregivers, and do they have what they need in order to be ready for the children in their care? Does grandmother have the concrete supports? Does she have the money or the housing or the beds or the concrete supports that she needs to take care of the grandchildren that she had no intention on raising? Does the aunt have the resilience to manage the stress of raising a child with special needs while simultaneously prohibiting her sister from entering the household who's maybe using substances? So these are real clinical issues that are associated with kinship care, and they can be risked, right? But we also know that kin can mitigate trauma caused by a removal because they maintain that child in the family, the culture, community, and their social connections. So in Arlington, with a lot of sweat equity, we began to really debate and think about how we can impact change in this area. And so we developed a kinship assessment that has provided us with some really helpful information when we go out to assess families. We're looking at the minimum health and safety standards, but we're also setting the stage for us to explore the clinical issues that may eventually impede the safety of that child if they're not addressed, and if those protective factors aren't bolstered. So that has been really, really critical in helping us to go to court, for example, and say, hey, we've vetted grandma, we know this is going to be hard, but she has all of these areas and these supports and these resources to make this possible. And so we want to recommend that we move forward with this plan for this child because we believe it's in that child's best interest. So I'm going to move on because I could probably talk about that all day, but I'm going to move on to clinical documentation. My team and I spent a lot of time trying to improve communication related to the decisions that we're making with families. Honestly, there was a point in time over my last 6 years of tenure here that we were struggling to build credibility with our court officials, particularly, because their risk tolerance was a little lower than ours. We were willing to take that chance on that family or that caregiver or that parent. And the courts wanted and they deserved more information for us so that they could make good safety decisions. So we began to use the protective factors as a mechanism to assess and plan, intervene, and to document our efforts and speak both in our written documentation and our oral presentations in court. So we have a structured way in which we're doing our notes, and it's the DAP format, the Data Assessment Plan. And you can see it here where it sort of clearly outlines connections and concrete supports and resilience of parents or lack thereof, and what we're doing and the strategies that we're employing to move that family, work with that family and get them to the next place. And we just had a Child and Family Services review where the reviewer congratulated us on the way in which our notes were written and mentioned that as a specific strength for Arlington, and we're really, really proud of that. So I want to take a minute to talk about assessment and planning. So of course, assessing is all about gathering the information that helps support your understanding and your planning with the families. And I said with the families, not doing something to them. So here you see the 5 protective factors that are listed. And I'm just highlighting this. So a family, for example, might fare reasonably well with, the day-to-day life stressors, but may not when it comes to child rearing. Their social connections may buffer the risk because they're not isolated. They have a church family. They feel connected to the people in their community. And they may have some adequate housing, or their basic needs might be met, right? But still, they may have some real unrealistic expectations of the children that they're parenting. And those children may also be struggling to manage themselves in school. So it's looking at that family, making the assessment of what's strong and what needs to be bolstered. And I'm going to take a minute to sort of show you a real-life example of how a worker assessed what's going well with the family and how she captured it in a report to the court. And as you can see, it says, Mr. and Mrs. D are loving parents who openly show joy and enthusiasm at spending time with their children. The D family has identified social connections through family and church members in their area who are able to provide emotional support and offer concrete support in caring for their children. They value education and respect and responsibility and want their children's religious beliefs to guide them to be self-disciplined. They want to have a strong, trusting relationship with their children and express commitment to creating a positive future together for their family. So that was how a worker assessed the strength. And then she moved on to identify the protective factors that needed further strengthening so that she could support the family in planning together. And so it goes on to say they're managing their life stressors associated with limited financial resources. They've sought public assistance and they work seasonal jobs when they can find it. The parents have struggled to create a physically and emotionally safe environment for their 3 children. Family conflict stems from unrealistic expectations of the children's behaviors given their respective ages. To achieve the goal of reunification, both the parents must gain a better understanding of child development and adjust their expectations to meet their children's abilities. They will benefit from replacing their punitive parenting style with disciplined techniques that foster cooperation and positive emotional growth in their children. I gotta tell you, I was thrilled when I read this report because it speaks to how people are really embedding this in their documentation. And it goes on. As you can see, this is the plan that they came up with together, and we're hoping that this plan gets the family one step closer to safe case closure through reunification. And I'll read it. It says, the Ds agreed to participate in parenting classes to build skills related to effective discipline and how to respond constructively to their children's negative behaviors. Both parents have agreed to home-based services. We should do a lot of home-based services in Arlington that will support them in creating the routines and managing child behaviors during their weekend visitation. The children will begin weekend visits starting October 14th, tomorrow. The hope is that the children can return in protective supervision status in time for the Christmas holiday season. This will allow for a smooth transition into school for the new year, and the next family partnership meeting is scheduled for December 2nd of 2016. So we're hopeful about the outcome for this family and hoping that it will, in fact, as the next slide indicates, lead to a safe case closure. Of course, all the planning that you put into when you're working with a family, you want it to take hold. You want the caregiver to not only just demonstrate but sustain the behavioral changes so that they're functioning day to day in a sufficient way and demonstrating some protective parenting. So at the conclusion of the time of our work together, we really want the parents and the children to live safely together and function independently outside of CPS intervention. So we looked at this, we were taking a look at our QSR, quality service review protocols, and really wanted to make sure we were capturing all the elements, and then how could we infuse the protective factors in this. So if you look at this checklist, you'll see things like the budget and the housing, that's concrete needs. Identifying the 2 supports speaks to the social connections. Linking the services to help parental stress and to manage the trauma associated in the family. And so all of the direct service staff and the supervisors have this checklist nearby, and it serves as a reminder to ensure that they're, taking note of these things and monitoring the progress, documenting it throughout, and making sure that the treatment team knows where the family is and making any needed course corrections throughout the life of the case. So next I'm going to turn your attention to how we support families in building skills through the knowledge of parenting and child development. About 2 years ago, we began a contractual relationship with Phillips Family Partners to craft a parenting education program designed with the protective factors framework in mind. We didn't want parents to just sit in a class and be talked to. We really wanted to, this to embody the protective factors. We wanted to ensure that families could truly gain the knowledge and skills in a more meaningful way. So the vision for the class was to target families, first and foremost, who were either at risk of being involved with child protective services and juvenile courts, or who were already involved in the system and were really trying to reunify as quickly as possible. So we honored social connections piece by encouraging the participants of the class to bring a family member or a trusted adult with them to the class so that this partner could hear the same information at the same time and serve as an accountability partner and, an additional safety net for that child. And because of this, admittedly, the class sizes are a little bit smaller than usual because we're really trying to deal with family systems. We attune to the concrete needs of families by making sure that we remove obstacles for attendance. We're offering bus tokens. We have child care that's offered. We feed people during the class. We offer healthy food. We've had some people didn't want the healthy food. Some people wanted some of the junk food. So they've grown throughout the class to eat more healthily. Each participant takes the protective factor survey before the class session begins and at the conclusion of the 8-week session. One of the highlights of the class that I just really, really, really love is that there's a home visitation component to this class. So the instructor goes out to each parent's home to ideally observe the parent-child interaction in an effort to provide some real-time feedback so that the classroom learning is reinforced. This is a little labor-intensive for Phillips and the instructors, but they do an amazing job. And the participants have really given us some good feedback about it. In the beginning, they don't love it as much. They're a little hesitant, maybe a little distrustful in the beginning that someone else is coming out to their home, but they quickly relax because of the rapport that's built in the parenting sessions. They're eating together, they're sharing their parenting challenges and their successes, and the format just lends itself to a lot of conversation and, of course, learning new strategies for dealing with behaviors while they're having fun. So we got some good qualitative data on the parenting education classes that, indicates that the families are experiencing at least a 25% increase in some of the areas of family functioning, social emotional support, concrete support, and nurturing and attachment to their child. Participants have also indicated that they enjoy the non-judgmental way in which the instructors facilitate the class, and that they've actually bonded throughout. One cohort, in fact, enjoyed each other's company so much that they had after the session was over, they had a barbecue and invited each other and the kids there so that they could continue their connections, and that was just amazing. So we are so grateful to have a solid relationships with Phillips Family Partners, and hopefully someone from there is on the line today. And we just want to continue that.
Yes,
we also have
actually on the line, Tabitha, so shout out.
Oh, she is? Okay.
Yes.
Shout out to Roseanne. Thank you. It's been an amazing collaboration, and she may want to share something a little bit later. We also have courses for families who are simply wanting to bond and explore with their toddlers and each other. On the next slide, you'll see about our Project Family, and they're held in community. These are circle time, playtime, parents and children held at community centers at various places throughout the Arlington community. And these are extremely well received as well. The facilitators are, crisscross applesauce with parents, and they're reading books and they're singing songs and they're modeling effective play and cooperation for parents. They're using language that labels feelings, so you're looking at that whole social emotional competence piece. And then for parents who may be struggling, or for a child that they may observe to have some delays, they're able to make some really quick referrals for early intervention services. So we're really proud of that as well. So let's spend just a minute talking about reallocation of funding and resources. I mentioned earlier, it's really probably unnecessary for you to request a lot of additional funding. However, it is necessary that you are familiar with your funding streams so that you can fully maximize and be creative in the use of them. For example, we have shifted the use of the Promoting Safe and Stable Families funds to make sure that we are using it for the concrete support, such as rental assistance or startup kits for those who need help with housing, or providing bridge funds for the relative caregiver who might be awaiting a foster care payment but needs a little help in the interim. We use it for transportation to make sure that families can get back and forth to services, to our parenting classes. And our actual parenting class through Phillips is also funded through our PSSF funds. And those funds are federal, and so it's not limited to Arlington County, so I encourage you to get to spending that money because you can use it to, help families resolve crisis, to connect with families, families to services, and to help maintain them safely in their homes so that those children don't come into care to begin with. So family support and stabilization, family preservation funds. You know, we saw an increased need to change things as our environment, as the landscape have changed over time. We've had to repurpose positions to fill a need. I'll give you an example. We have a mental health therapist who serves as a court liaison. He is stationed at the courthouse, and the whole intent for his work is to identify those youth with mental health and substance abuse needs who may be experiencing a crisis and need linkage to services, rather than them coming into the juvenile justice or foster care system. This position has been awesome in building greater communication with the judges, our probation staff, and our court officials, and we've really reduced unnecessary court involvement for those youth. We have some data, for example, on FY15, the data says that 78% of the youth that came to his attention were diverted and had no court involvement 60 days after the diversion. So that was like 45 out of the 58 kids were diverted. And more recently, we had a vacancy, and we wanted to think about, you know, what should we do with this? So should we hire into the position as it previously, you know, was held, or should we create something new? And we created a family support coordinator position with the family strengthening principles in mind. So this person's role, she's responsible for managing 3 core strategies. She manages the FPM program, she supports parents, does parental support and navigation, and she is the liaison with Phillips to the parenting education. So workers can make a referral to her team for specific support around the protective factors. For example, a parent might need help during family time or visitation to engage in appropriate play and discipline. The family support worker will go in to the visit and model and coach the parent. The family support worker may also see that that family is in need of an emergency food supply. So let's get in the car. Let's go to the food bank or to the local pantry in your area, so you know where to go, what to do in case you have another, you know, food crisis in the future. And as much as we've done, and I think we've been pretty creative with the resources that we have, we can't do it alone. We're one part of the safety net for children, so the other piece of that wheel centers around system capacity building. And of course, children come with villages, right? They come with parents and caregivers and schools and all kinds of, you know, community stakeholders. So we spent some time thinking about how could we build a better safety net for the children. And so we do a lot of education and outreach into the Arlington community. For example, the behavioral health care staff have gone into the school system to train educators on signs of mental illness so that they were more apt to make the referrals for those youth who needed assistance. So we partner well with our school system. So far we've trained about 320 staff in Arlington Public Schools. School staff are also taking advantage of an online suicide prevention course that we are partnering with them to make sure that they do and that they have available at their disposal. And all youth who enter foster care are assessed for trauma within 3 to 5 days of being removed from their birth parents or caregiver's home. We instituted that as a mandatory practice, as a policy, So those are just a few of the ways that we're taking sort of a trauma lens with the promotive factors approach. And we also, Arlington is committed to children and families and knowing what's happening in the community. So we have a group that's called the Arlington Partnership for Children, Youth, and Families, and they conduct a survey of youth risk behaviors every 3 years to about 2,300 students across the middle schools and high schools. And they compile that data. It's a lot of work, and they create a community report card which identifies areas of concern in Arlington County and sets the priorities for action. You know, it's a really like a compelling report that can even implicate policy change. So we take all of these things like really, really seriously. Last but not least, we train our managers, we train staff, we're building our own internal capacity on the protective and the promotive factors. When we bring external trainers to Arlington County, I've often had conversations about, you know, tell me what you know about strengthening families and the promotive factors, so that they can, our staff can hear about the protective and promotive factors in more than one way. And I'm gonna like go really fast here and just say that I'll brag about the collaboration with CSSP. We created a toolkit for supervisors that helps to connect supervision to protective factors. We just launched it in July, and we're really super excited about it. Kaylin's gonna talk about it shortly. Some people ask me about reflections and what did you learn, and I'm just like, wow, this is a lot of work. And so you really have to have strong leadership who understands the urgency of this work, because children can't wait. So, and I don't mean like leaders who are just at the top of the quote-unquote food chain. Anybody is a leader, and you know, you need the person that can impact the policy and the money, but you want those change champions, those people who can listen, involve cross-functional teams, and help to shape the vision and the direction. So I'm blessed to have a lot of the managers and frontline staff who really get this and walk hand in hand with us. And they'll give us feedback. For example, our behavioral health care team didn't always see themselves in some of the documents, and so I would encourage you to manage your message and to just keep messaging so that everybody feels included in this process, because you're really stronger when you have a collective body of staff who are moving together in the same direction. And I know we're running sort of out of time, but so I'm going to just say there's a lot more to do. We're really, we're really committed to and motivated, because we've had some success and we want to continue to see success. And so the next frontier is on prevention, really. So I want to just thank you for your time. Kaylin, you can just whip through the next slide. And yeah, I want to thank you because I know you guys are busy people, and I hope that you walk away knowing that this is doable. You can create some big differences through small and significant changes, and I'm available. As you can see, there's my information there.
Thank you so much, Tabitha. I think that was really helpful. You shared a lot of great information. I'm going to go just quickly through what's in the Supervisor's Toolkit that Tabitha mentioned they just started using in July in Arlington County. This includes some tools that you may have seen before if you've been following our development of tools for child welfare work, and some tools that were not created until we needed them for this particular use. And it's a really nice way of sort of organizing all those tools that are available. I think in some ways, while we have a lot of tools out there, it can be a little challenging to kind of figure out what's what and how to put them together. So what we did was broke it down into 4 parts. The first part of the supervisor's tool goes through coaching on protective and promotive factors. So that includes some basic information about coaching, what the supervisor's role can be, and then for each protective factor, sharing a research brief on that protective factor in strengthening families, and a caseworker action sheet, which I believe you may have seen before, but if not, I encourage you to download the packet that's here as a handout in the webinar of the Strengthening Families and Youth Thrive research briefs and action sheets. So then after you have the Strengthening Families set, you have the Youth Thrive set for the protective and promotive factor that corresponds to that Strengthening Families protective factor. And newly developed action sheets for the Youth Thrive side, which are not yet available on our website but will be soon, but you have sneak peek access to them today if you want to download it from the webinar. And then some coaching activities for each protective factor. The second part of the tool, or the toolkit, sorry, goes through the core functions of practice and shares tools for how to apply a protective and promotive factors approach in each of those core functions. So for an example, I'm showing the little subsection table of contents for services and supports planning. There's a worksheet that you may have seen before called Using Protective Factors to Develop Case Plan Tasks and Activities. And then there's a new tool called the Practice Reflection Tool. We developed one of these for each of the core functions. It's a self-assessment for a worker to use, although it could certainly make sense to use it in the context of supervision. It's not the supervisor assessing the worker, but the worker assessing themselves. And taking a set of actions or strategies that would help families to build protective and promotive factors in the context of your work in this particular core function, and then rating how consistently you do that and making some notes. So this is not a validated or tested tool, but it's in use now in Arlington, and hopefully people are enjoying it, finding meaning from it, and we'll maybe check back in on it in a while and see if there's anything that should change. But those are available on our website and also available to download here in the webinar. The third part of the toolkit goes through action planning, and this is something that we developed, again, specifically for this toolkit with Arlington. It's co-branded with Arlington County, and we have not put this on our website yet, but if someone wanted to adapt it for use, let me know, and we can see if you can do that, or how you could do that. But basically, it's 3 pages. So there's a page about increasing knowledge, a page about building skills, and a page about putting it into practice. And for each one, you sort of state an objective and what tasks you're going to do, target dates, and notes. And there are suggestions along the bottom that you can see here that for what those, what the knowledge building might be, and on the other ones, the skill building and the putting it into practice. And finally, the fourth part is handouts on self-care. So it includes a tool for kinship care providers, a tool for foster parents, and a tool for workers themselves to think about protective factors in their own lives, stressing the importance of self-care. So that's the toolkit that's available in Arlington. As I said, most of the pieces of it are available on our website. And if you are looking for some piece of it, let me know. If you'd like to see the full Arlington toolkit, I believe I could share that with you. It's big. It's a large, bulky file, but I'd be happy to share it with you. And if other jurisdictions wanted to recreate that, we could talk about what that would look like. So I know that we are running up to the end of our time. A couple people have commented. Tabitha put her email address there for anyone who'd like to reach her. It's in the chat box. And I am going to try to unmute Roseanne. Sorry, I muted myself as I said that word. I'm going to see if we can unmute Roseanne so she can jump in from Phillips Family Programs.
But I just wanted you to know, you don't have to, there's, I gave her me to follow up with, so you don't have to,
okay.
You can cross it off your list.
Okay, someone else was speaking. I'm going to try again. Roseanne, are you there?
Unmuted now, thank you. Hi everyone, my name is Roseanne Renteria and I work with Phillips Programs, Family Partners. There was a program that I think you may want to know about. Tabitha's team also put together. It was called I'm with Dad Day, and I remember they had 150 participants, and it was really cool to see that basically normalizing parenting and really making it a priority to reach out to that special population of dads. I just really wanted to congratulate them and mention that one. In terms of the research, some of the surprises, or maybe not surprises, but we really did see a lot of impact with the parenting ed around concrete support. And it was a really big increase from pre to post on the protective factor survey. They really did know where to go for help. That was a really big deal, in part because of the isolation, and they got the skills, right, for the protective factor to live the principle or live the protective factor, which is to go and get the help where you need it. The other place that we are seeing changes is in behavior change, and that has to do with communication and expectations. So it's around the protective factor of the knowledge of parenting going up and the knowledge of child and adolescent development going up, because we are seeing that parents are getting a better understanding of what to do when they are with their children and how to communicate, how to behave. So I just wanted to point out those two areas that we're finding some major impact and outcomes upon.
Thank you so much, Roseanne. I'm glad you were with us with other members of your team there too, and that you were able to share some of the ways that you're involved and what you're seeing with this work at the county level. Thank you so much.
You're welcome.
With that, I'm sorry that we haven't had time to take other questions, but we are at the end of our time. I really, really appreciate Tabitha's presentation. I know a lot of you did too. People are typing in thank you, and we always appreciate that. As usual, we did record this, and it will be available. The recording you can access when the follow-up email goes out, and then I believe tomorrow we'll get things posted up on the Alliance's site where you can access the PowerPoint and everything. So thanks again, everyone, for joining us. Tabitha, thank you very, very much, and keep up the good work. Very happy to be able to partner with you, and very glad we're sharing this with the rest of the network. Have a great afternoon, everybody.
Thank you.